Chicago! Hope everyone is doing well. You guys are in for a treat. Your eyes are not deceiving you. It is three of us. I'm so excited that we are all back together again, the Community Pulse team. We have some exciting updates that we wanted to share. But first, let me introduce myself, and I'll have my co-hosts introduce themselves as well. My name is Tacora Love. I am one of the rotating co-hosts. I represent Academy of Medical Surgical Nursing, Chicago 317, and Hectone Nurses for Humanity. All right, that was a mouthful, so I'm going to pass it over to Levi, and then I will actually introduce our guest, our star of honor.
Great. It's never to hear me say, no, this is going to be like, one of those old bands that everybody went their way and, had a solo career. And this is like our reunion concert right now.
Yes.
So, but yeah, this is great. But now I need to do the housekeeping. Okay. Follow. Okay. My name is Levi Moore, and I'm the Foxglove Alliance Coordinator, which means nothing to you. But, this show is sponsored by the Hectone Institute of Medicine. Hectone's been around for 80 years in Chicago. At one point, it was even the research arm of Cook County Health and Hospital System. For decades, it's been involved in a number of public health medical programs and initiatives. One is sponsoring this show. It's sponsored by Hectone. And part of my duties at Hectone is to serve as the coordinator of the Foxglove Alliance, which is a coalition of 15 public health organizations, and of which one of the members is the Academy of Medical Surgical Nurses Chicago chapter. And we utilize Community Pulse. It's a public affairs show about public health and wellness in Chicago. We use this as a promotional and education tool to talk about, issues that are important in the sector, highlight individuals, talk about members and partners. So that's why we are here. And back to you, Tacora.
All right, I'll take it back. That is Levi's favorite part.
No, it is not.
He has that mastered. But I have the pleasure of not only sitting next to you, reconnecting with a mentor, a friend, Meghan Phillipp.
Thank you.
Yes. So Meghan is the founder and chief impact officer of Impactful Partner Solution. All right, that was a mouthful. It is a Chicago-based firm that is focused on helping organizations turn purpose into measurable impact. Wow. As part of her portfolio, which she'll speak a lot about, she also serves as a senior advisor to Third Horizons, a national healthcare advisory firm, and innovative officer for women in medicine. And this is the newest highlight that we just really, really want to focus on, and we're so very proud of Meghan. And Women in Medicine is a national platform for women in healthcare leadership. So we are going to turn it over to our guest of honor.
Thank you. Yes, it's such a pleasure to be here. I was with Community Pulse when we named it Community Pulse. So I've been, in and out the door around the TV show and both of you alongside many of our guests. And just coming back today, it reminded me of all the wonderful conversations I've gotten to have through the show. I did want to just name and honor one of our guests of the past. It's a very sad story that she passed suddenly in a car accident this past December alongside her husband. But AJ Barks was the executive director of a women's healthcare center. What an honor it was to have her on this show and to have the memory of the work that her and her husband do, because he led Mobile Care Chicago. is a reminder of the opportunities and the conversations that platforms like this offer. And I just was thinking about all the wonderful people I met through this and I keep in touch with, and I see more work happening. So I just wanted to share that, that we're thinking of them and their memory.
Her husband was a new board member of the Illinois Association of Free and Charitable
they were
Nurses,
very,
and he never got to attend a board meeting.
yeah.
It was so, he was nominated, and then like 2 weeks later, he passed.
Yeah, it was very tragic to lose two incredible Chicagoans that were doing work in the free and charitable sector, and so it's just, yeah, it's very sad. But we there is a celebration of life coming up, and so I just want to name that, you know, it's a privilege and an honor to know people that do that work and to continue to try to, you know, carry that torch in the work that they believed in.
And we'll continue to honor their legacy with the work that we do and the meaningful impact that we have.
Yeah. But I guess on to the exciting things. Like, you know, when I came to this work together with Foxglove, with all of our organizations, I led a platform called the Healthcare Council of Chicago, which is currently on hiatus, but I'm really excited to continue to do what I do, which is kind of fill holes and gaps and kind of play in the sandbox with lots of people. So I am leading my own sort of portfolio, as Tacora mentioned. One of the great honors has been to be named the Innovation Officer with Women in Medicine. They're a national platform that is leading the way around women in medicine. They were founded about 8 years ago as a one platform summit. Dr. Jane is an incredible oncologist at UIC. She just saw a need and said, let me just host something, and then it's just kind of evolved into that. And so we just celebrated 8 years as an organization in March, and we will host our 8th annual summit this September.
Looking forward to it.
I'm really excited, you know, about the opportunity because, of course, I know Dr. Jane and several others locally, but I just have had the incredible honor and privilege of recognizing the real need for women in healthcare leadership, which we continue to know is a challenge. But women are 37 to 40% of active physicians across our spectrum.
And probably growing.
And growing.
For
And I was going to
sure.
say more than 50% of medical school entrants are women. Yet only 15 to 20% are in our leadership realm of hospital systems and otherwise. So we need to continue to encourage and support the incredible leaders that women are in our communities, because we know that when women are at the helm, better things happen. And our allies as well. So, you know, it's about the intermix of how we support this mission to educate, support, find out why women are finding that there are challenges in being in leadership, and offering them resources. So I'm incredibly excited that we've launched a Wombassador program. So that's a way for women doctors specifically to engage with the platform. There are opportunities to join our speakers bureau, to find ways to find opportunities to speak and be a thought leader. We're also in percolating new programming and opportunities for next year, so stay tuned. But for now, the summit is the best way for anyone, including you, Levi, our allies and our women, to come to be part of an incredible 3 days of leadership programming. It's amazing. Also on Friday night, the gala. So this is September 24th through the 26th, and on the 25th is the gala. I have never seen women physicians get down on the dance floor like this. So I give you a plug to attend this gala. And it's an incredible band and an incredibly fun, exciting night to celebrate just people doing awesome stuff. So,
and I'm so glad that you mentioned that you have allies and that it's open to women in healthcare leadership, but not only women, because that was one of the questions. Is this just a physician-based only?
That's I actually thought that.
Yeah.
Initially.
So there are different levels of how we engage. Of course, one of the core tenets has been there really is no space for women doctors. So we are very much focused on that. However, we also understand the spectrum of because as you as a nurse,
Yes.
I mean, there are so many other opportunities, and we see this across all of healthcare leadership in general.
Yes.
Even prior to
Absolutely.
my role, a lot of what we worked on with workforce in Chicago is also how are we looking from those entry-level positions all the way up.
I love
and
that.
how do we think about those opportunities? And what we found is there are some different things that exist. So our focus has very specific programming for doctors, including, you know, we have a student ambassador program at the summit that we're looking to expand upon, because what we're learning is that residents don't get the support that they need to kind of be the bridge in their careers. So we're looking at that. So it's multifaceted, but of course, a lot of the summit and several of our programs and a lot of our activities definitely are inclusive of everyone because it takes a village, of course.
For sure.
But we are highly encouraging of our women doctors that have gone and have done the work, have like done all this schooling, have done all of this, but yet aren't getting the recognition and the sort of supports that they need.
Absolutely.
And I'm also encouraged to think about how what does it look like for nurses? What does it look like for other people or positions or people that want to get onto those tracks? And what are those gaps that we just continue to keep failing, you know, as a system, you
Absolutely.
know? And we're excited to be doing more with our research lab, to do more. One, it offers opportunities for students that require those hours and those research capabilities, the opportunity to engage. But then also, it's like, how do we tell our story? How do we understand and not just make up the story, not made up numbers, not just like facts and figures, but also it goes hand in hand. It's like a feeling, it's an understanding that like women carry a lot. We carry a lot of different roles in life. And I think that what we're understanding, whether it's women in medicine or not, I think it's industry agnostic that we see challenges across the board about how we're not setting people up for success in their careers, in their lives. So it's very exciting to kind of focus on this particular area of interest and know that we are supporting some of the best and brightest in their journey.
You know, it's the support, it's also the resources, and then it's the sustainability of it all.
Yes.
You know, because those roles and wearing those hats, you know, they switch at different points in your career.
Yes.
So I think that it's amazing that you have that. So I would definitely be in attendance.
Yay! I love it. I love it.
Ally, our chief medical officer at Northwestern, Dr. Diane Wayne, she is a member and she talks about highly women in medicine.
I love it.
So
see, our reputation precedes us.
It does. It does. So, you know, definitely be in attendance. I'm sorry, Levi.
No, it's just, it made me think about how the shortage in healthcare workers in general and a lot of the people doing big thinking and it's like, oh, it was because of COVID, burnout, And it's like, whoa. It's demographics. Every day in America, 10,000 people are turning 65 and they retire. And that's going to last for about another 3 years. And now there's this gap.
Significant gap.
And it's at the low level and it's also at the high levels of management and operations. And it's great that, you know, the opportunity's there and it sounds like women in medicine is going is going to parlay the opportunity.
Absolutely. And I think that we are at a really interesting precipice as we look at how all of us show up in the workplace. I feel like how many of us feel replaced or replaceable by technology, AI, etc. And it's more about how are we looking to integrate and empower and encourage versus like this or that, I think, in general.
Oh, I wholeheartedly agree. I think I can speak from a personal standpoint. When it first started with AI, I'm like, I'm not touching that. Now it's like, oh, there's Copilot. Oh, it's this. And, you know, it makes things just a little bit easier for the processes. So it's more now, the stance is adapt to it because AI, it's not going anywhere.
Yeah.
Right? So it's being able to learn about it and how to integrate it and utilize it in your, you know, day-to-day work and professionally and personally.
Funny you should mention that.
I knew Levi had something to follow up with.
Because
For sure.
I was going to do it, I was going to try to do it in May. 2 weeks ago, I went to this incredible kind of think tanky thing about the impact of quantum in Illinois and how Chicago positioned itself as an international quantum hub, which is really starting to happen. Well, this group, it's going to become a thing. And it hit me. It's like, you know what would be timely? What is the impact of AI on health and medicine now and in the future? And then also, what will be the impact of quantum in healthcare and medicine in the future? And I was going to try to, literally, I was thinking about it as I was coming here. It's like, okay, is that one thing or is that so big? I think there's going to have to be two different events in the fall.
For sure.
So stay tuned.
All right.
Stay tuned.
Sounds
Stay
good.
tuned.
Yes. So what's next for you?
I mean, right now, I am really privileged to be working alongside Women in Medicine, still with Third Horizon, as they do more safety network and other things like their parity index and things like that. I also, am ever evolving and working with new nonprofits every day, so give me a call. But I am just, I'm very excited and hopeful. I know it can feel like, honestly, like every day we open the news and there is more things being undone, unchecked. I just read this morning that Pritzker said we're going to lose several hundreds of people on SNAP as of May 1st. And, for me, it's just like, what is the problem we can solve today or tomorrow? And how can I help is kind of how I'm approaching it. So.
But from your work with community health, we had a meeting, committee meeting, and it was something I told Tacora about. There is the impact of losing the ACA credits, the Obama credits, has hit. Almost all of the free clinics that are part of the IFCC, except I want to think the mobile ones, are here to turn people away. It's people who have always had insurance, and it could be for, and it took them a while to figure out, if you don't have a health insurance, what do you do? It's like, I can go to a free and charitable clinic, and it's a problem.
Yeah. I have the incredible privilege of serving as the Associate Board President of Community Health right now. And they are one of many, as you mentioned. There are over 40, 50 different free and charitable clinics across the state. Right now, they're going to bat, they're going to advocacy in Springfield to make sure that we have funding for these types of things. So my recommendation is, whether you think you're political or not, you should be paying attention to where funding is being allocated, what your representatives are looking at, what concerns you, what keeps you up at night, what access looks like in your community. It can be anything from, just healthcare to pharmacy. I just saw that, it's really exciting to see a national brand like CVS thinking differently and not opening a whole brick and mortar, but just a pharmacy in a neighborhood that needs it in South Shore. So thinking about what does access look like, and this is just beyond just the healthcare. For me personally, it's always comes back to my love of community health and the IFCC and a lot of the work that we're doing to just make sure that people know what's available to them and making sure they have access. So if you have lost insurance, go to the Illinois Free and Charitable Clinics website. I think it's illinoisfreeclinics.org. Please check that out. There are tons of resources available to you. And then for those that are on the flip side that are helping people, those are resources for you as well. And then the other thing I always say is it's an 80-20. 80% of health is not actually healthcare. That's the 20% that we're talking about. But housing, education, social services, there's so many things that are in flux right now. And I just hope that we can continue to look at Chicago as a thriving community that knows how to leverage community. And I think that we have a lot of resources, I was just at Fast Pitch by SVP Chicago last night, where 10 nonprofits pitched what they do, and it runs the gamut of, education to running a summer camp, and I just can't recommend highly enough to get involved in your community or into mutual aid. So, yeah. That's my plug for the world.
That was a great plug because, as you mentioned, the things you're speaking about is our social determinants of health. so many people, our patients in our community, they're affected by those things. And as you mentioned, in our discussion, many people don't know where to go for free clinics, so they don't do anything. Consequently, their health suffers on the back end. It's a domino effect. So thank you for sharing that website. What else can we do to increase awareness about these resources?
Yeah, and I think it's also making sure you do have eligibility, and I also encourage you to go to IPHCA, which is also, if you do have insurance and you do need help navigating where to go or where there is access, they are our primary care association for all of the community health clinics across the state, and that includes sliding scales. So if you have means of any sort, they will still be able to take you at our FQHCs and otherwise, and they're an incredible organization doing a ton also to kind of advocate and make sure that we're keeping policies like 340B and other things in place to protect ourselves from those costs. So I also encourage that. And then I also think that, we are at the precipice of a national midterm, and I think that you should just continue to look at what is coming up, what matters to me, what matters to my community, how am I showing up to support that, whether that's actually helping at the polls this November, or if it's, anticipating where you have things that you want to make sure that your elected officials are looking at. We have an opportunity to keep some great people in office and vote some new people in, and I think it's just an incredible time to vote with your feet and continue to move those things forward.
Yeah. I love that analogy.
I want to put you on the spot on something. Because I've actually wondered this. Okay, describe...
Typical Levi fashion.
Describe what Third Horizon does.
Oh, so Third Horizon, also, I remain an advocate and a supporter and a team member as a senior advisor. Third Horizon is a healthcare consultancy on the national scale. I want to give them a shout out. Their partnership with the Kennedy Forum as of recently. We started a year or two ago with the Parity Index for the state of Illinois. It is now national. So anybody can go to parityindex.org, I believe. And you can see the comparison of mental health parity to physical health. So when we talk about parity, it talks about the evenness of how we cover physical health care versus mental health care. And essentially, Patrick Kennedy and the forum have decided, we're not doing a good enough job of treating mental health just as much as we treat physical health. So the index actually helps us understand how we're not actually following legal regulatory things that we have in place as long as they stay, which we also need to advocate for. And it really helps us paint a picture of where we have gaps, where there's opportunity for payment reform and other opportunities to cover mental health. Because we also know that mental health is just as important as our physical health, if not more so, because it impacts.
Please say that again, for sure.
So that is one facet of what...
Did we actually do anything in Chicago? I remember 7 years ago, mental health is a problem. Say, okay, have you actually done anything about it, Chicago, or...
I said, so the Parity Index is for the state of Illinois, so it's for the full state. We have an incredible mix of, we have incredible providers on the ground like Thresholds, Rosecrans, others that are doing incredible work in a day-to-day, week-to-week, Safe Haven with their integration of housing and mental health. I mean, we're doing a lot, but it's also just... It's coordinated, but also disparate because we are so, it's neighborhood by neighborhood. We have our West Side Heroin Task Force, which we interviewed on here for. I mean, it's multifaceted of what the need and what the opportunities are. It's just a matter of how we make sure those are being integrated into our systems. So it's a great question.
Yes.
I don't know that there's one specific answer I could give.
Well, I remember there was this split between, you need to reopen the old centers, and then there was another school of thought that no, there are ways that you can do it that are different where you can have a bigger reach, and it seemed like there was this standoff. And
Yeah. There was that, and CDPH did open new clinics that I don't recall off the top of my head where they are located. I believe they're south and west. There are some clinics with some of those services. Also, CDPH, shout out for doing all the sort of Narcan
Yes.
vending
The
machines
training.
and things like that. There's so many things like that. There's also incredible partnerships with like Thresholds and Northwestern, like within Starbucks to like help, with supportive services. So I think there are things that are happening, and there were clinics that were opened under this administration. Which is wonderful. I think that access is access, and we should take it where we can get. Of course, we do have, I think the argument was always that we already do have wonderful community-based organizations doing the work. So why should there be like government ones? And it's just, it's a choice for everyone, and I'm not going to comment on it, but I will just say that there have been some that opened.
Yes, there's
as
some
far
that-
as I know, we are operating and being successful. I know that also Cook County has their behavioral health initiative. So Dr. Nutter at Cook County is doing an incredible job. I believe they'll probably have another convening this fall as they convene all of the mental health. And I know that Cook County is also taking a bigger role in how do they take they have like different zones that they're
Yes,
coordinating
yes.
and different committees. So there's ways of getting involved through counties like overarching oversight of behavioral health access.
There's definitely great work being done. Just need more of it, and so definitely, as Megan said earlier, let's start to volunteer in your communities and all of those things, and see what resources are available. I definitely wish we had more time. The three of us together, there's so much
I
conversation.
know. I realized we just went through a lot of stuff, and I didn't know we were going to get to some of that.
I know, and there's so much more. So we may have to invite you back for
Always
part
happy
two.
to. These are my ride or dies. They are doing
Yes.
tremendous work, both in their professional and personal lives to make a difference in Chicago. So grateful to be here.
Thank you so much. All right, over to you, Levi.
Okay, thanks for helping me start this. Thanks for helping me continue this. And
Love it.
as I said, hopefully we'll also be getting another rotating co-host very soon.
Yes. Thank you so much, Chicago. It's been a pleasure to have these two in the studio, but also you at home engaging and listening. And, the websites that were mentioned, please take the time to review those websites for resources.
Yeah.